Hi guys, welcome back to my channel. My name is Dr. Sisnet. If you're new to my channel, please subscribe. Today I'm just going to tell you what's been going on, some of the difficulties that I'm facing as a second degree medical doctor who is trying to get his dental degree to pursue oral and maxillofacial surgery training, whether it be in the United States, Canada, or Britain. So here's the thing. One of the main issues I'm having right now is that the money that I applied for from my home country was significantly less than what was needed to clear my balance. So I have upcoming exams, which are the quality assurance examinations, where they basically assess to see how much progress you've made over the period of time that you've been in clinic. We've had quite a few before. I've been given a blight to some extent to do the exams, but I have been blocked and barred from doing my final DDS exam. So the final DDS exam is needed for me to leave or even to start working to pay off what I owe and to move on. So that has been what's been playing on my mind for the last year and some change, but it's about nearly a year right now that I've been trying to figure out what I'm going to do with regards to doing my final DDS exam. So quality assurance examination starts in the next couple of weeks. I have one that starts May 30th and all the exams go to June 9th. Right now we're seeing patients and screening patients for those quality assurance exams because these exams are done on live patients. It includes periodontics where we do an SRP on 12 surfaces of teeth. Also we do extraction, class 2, class 1, class 3. Composite restorations, we fill under ADEX conditions. We do a prophy, and I don't think I've missed anything. We also do an endodontic procedure, but that's on a mannequin. So these are the things that I have coming up right now. Plus I have final DDS, which I'm hoping to be able to find some way to, I don't know, get it done. But I haven't found a solution, and technically I've been unemployed for the last couple of months. Can't even say how long, but from this year started after January, so like 3-4 months, I've been unable to secure solid work. Most times it's just a Saturday that I was sitting at an office and make maybe a couple $100 or whatever. So I've been unemployed. So I've just been managing. So one of the things that's been playing on my mind is that will I be able to finish my exams? And it's kind of sad because in terms of my quality assurance, I've been doing okay. I failed one exam, which was my class 1, which was surprising to me, but I managed to pass class 2, class 3. I did back over my class 1 exam, passed that, and I've been allowed to progress. In terms of my vivas, or what we will call our oral examinations, I got very good grades on the oral exam, and it's just kind of sad that you're making progress, but you're not making progress, if you get what I mean. In other words, I'm doing okay in school, but at the same time, I can't set my final exam. So that's kind of playing on my mind. And I've been trying to go to school, keep a positive attitude, but there are times when I'm just like, there's a possibility that I won't be able to sit my exams. And at the same time, I accept that. And that's just if that's how it has to be, that's just how it has to be. On the flip side, I messaged a consultant today to see if I can get a maxillofacial surgical job at Kingston Public Hospital. And I'm hoping he responds favorably, and we'll see how that goes. As for this week, as I told you about me completing a root canal on tooth number 31. This week I'm actually going to be completing a root canal on tooth number 18. Friday, which was yesterday, I completed a root canal on tooth number 13. So that's 2 root canals I've completed, and I will complete one on Tuesday. And hopefully, if I can push, maybe I can complete the maxillary molar that I started last week, Wednesday this week. There are things that I want to do tomorrow, which should be I want to work on my vlog, on my journal. I've completed the academic portion, which is the part that has in all the different cases. All the different procedures that we do in dentistry, but there's also another part that we have to place in it where we describe the treatment for our patient, and we put everything that we did for the patient, and we do it obviously with some anonymity, but at the same time, like there's 10 cases I have to put in the book, and we have to look for these cases, and they have to be appropriate cases. So that's something that's playing on my mind too. Another major hurdle, ADEX exam. ADEX exam is 4,000 US dollars. It's an exam that is based in the United States, but they actually have a testing center here. Testing center allows us to do the exam, and then we're allowed to apply for a license in dentistry right here in the Caribbean, which should be Jamaica, Barbados, Trinidad, and probably throughout the Lesser and Greater Antilles. It's an American-based examination. Even though we write it, we're not allowed to work in America, even though it's an American-based exam. I'm not too certain why that is, but it standardizes the dental training throughout. So I'm not certain if I don't have the money for school, I'm not certain I'll get the money for that. So yeah, that does open up doors. So these things are playing on my mind, but I'll just roll with the punches as it is. So vlog, I wanted to vlog today to make sure that I put this on record in terms of the struggles that I'm having. And this hasn't been an easy journey, as most of you who have been following me know, it has not been easy. But as the time comes down, and when I'm over this hurdle, I want you all to see that, we can overcome. So thanks for subscribing. Stay tuned, and please, if you're new, subscribe. Alright guys, another late day at school. Future Dr. Ashton leaving school now. Was a disappointing day, but such is life. Wanted to do a root canal on a patient, a close friend, and turns out the distal canal was inaccessible with the instruments. So it was a molar, tooth number 19, so I actually had to refer this patient to a specialist. So that was a little disappointing. But other than that, he still got some experience in terms of accessing, instrumenting, and I never got to obturate. And the instrumentation for the distal canal technically would have failed because I didn't get down to the apex. So I'm gonna head home now. This morning, what did I do this morning? This morning I did an impression for a denture for a patient, and that patient just needs a couple teeth on a denture. And I also did a perio charting for him because he has severe perio. Can't really go too much into detail with regards to that patient, but yeah. And now I'm just gonna head home. Tomorrow morning it's going to be fillings, and in the evening it's another root canal, a maxillary molar. So yeah, we'll see how that goes. Hi guys, so welcome back to my channel. So I'm at school. It's 7:44. School starts 8:30, but because I'm coming from a far distance, I tend to get to school very early because I get a drop down from where I live down to the school. So what will I be doing today? Today in the morning it's fillings. I'll be completing a treatment plan for a patient. And in the evening, it's a root canal. Hopefully I'll be able to finish. This is her second visit. What you see right here is a cast model I poured up yesterday for an impression I took for a 3-tooth denture, maxillary. And what you're going to see in this video is another denture that I finished as well too. And that will be delivered tomorrow afternoon. So yeah, it's been a busy week. And I'm actually getting kind of tired. So yesterday, during my daily routine in the evening, Dr. Darwin, check out his channel, Ask Dr. Darwin, or Dr. Darwin Speaks, I think that's the name of his channel. You can check it out. He had a very interesting podcast or live stream where he talked about getting into the oral and maxillofacial surgical residency. There was a guy there, Dr. Creighton, who is now going into oral and maxillofacial surgery residency at Howard, the 4-year program. So even though I'm not able to watch a lot of stuff, I was able to put it on, and while I was walking up, cleaning up, because it was late in the afternoon, while I was walking around and cleaning up, I was able to listen to it. So he offers some really, really good points. For one of them specifically was externships.
Now, remember, I think I spoke about this before. Externships are very important. He also spoke about keeping your grades up and ranking your universities based on what you're looking to do. For instance, he wanted to do a 4-year program, and he wanted to be in a level 1 trauma center, which is essential if you want to practice the full scope of oral and maxillofacial surgery, especially from the reconstructive part. So this guy had a plan, and he executed this plan, and he got into Howard. So congrats to him. My journey will be a lot different because I'm coming from a supposed third world. I asked during the podcast, so if there's any tips for, or if he knows any IMGs or IDGs or international dental graduates that he would have been working alongside when he was shadowing persons who did not go to the 2-year program. But I didn't really get much feedback from that. But at the same time, I got some tips with regards to trying to get into a program. So yeah, I was really impressed. He was very eloquent, and yeah, that information, check it out. Dr. Darwin has a really good page, and you'll see. As for today, as I told you, fillings, root canal in the afternoon. Then I go home and I'm going to try to study a bit. I haven't been studying a lot. I've been feeling kind of tired. I don't know if you can see, but my eyes are kind of discolored. Well, slightly. And I've been trying to finish off a journal because it's due Friday. And yeah, that's not going that well. I finished most of it, but a large portion of it is incomplete. So that's the plan for the rest of this week. So I hope you enjoy this video. It's a long video, but I was trying to give you some good solid content. I was gonna place it, gonna show it in parts, but I figured like y'all would want to see it from start to finish.
Yeah.